Hi, I'm Liz Greenfield. I'm a functional wellness practitioner. Have you ever thought about seeing a functional wellness practitioner for some of the chronic or long-term issues that you've been having? So many people with things like chronic pain, fatigue, resistant weight loss, sleep disturbances, skin issues, think about seeing a functional wellness provider or a functional medicine practitioner, but just aren't sure if it's right for them. One way to think about this is by asking yourself a few questions. Question number one is very basic. Do you have a chronic health condition that has not been resolved no matter what you've tried with traditional modalities, and it just persists? It won't go away and you don't have a good understanding of why that's happening. Number two, when you do go to see your regular providers, do you feel like you have the time that you need to explain what's going on? If you are able to explain it, do you feel like your provider hears what it is that you're saying and has a good understanding of what that means for you and is able to provide you with a solution, either temporary or permanent, for whatever it is that you're dealing with? Are you starting to feel like you just don't want to add any more medications to your regime because it seems like this is a never-ending pathway? Many providers rely on prescriptions in order to try to make patients feel better, but this is just covering up symptoms rather than helping people understand why they're feeling like that in the first place. In functional wellness, I use advanced labs as a window into a person's body to try to understand why their body is not functioning optimally for them. The body needs to be supported, and the reason for this is different for each individual, and the labs show us exactly what it is within the body that needs the extra support and care and attention, hopefully only temporarily. People with resistant weight loss, for example, may try many different diets without resolution and feel that they are resistant to weight loss. But in many cases, it's simply because they have one specific genetic type or another that actually determines what kind of interventions with food are going to help them be successful at becoming and maintaining the weight that they really want to be. Any type of chronic issue is like this, that we can really become detectives and use labs and get to the bottom of the root cause for why you might be feeling a certain way. And then the interventions that are personalized for you based on that information are not rocket science, but they make sense. They are easy to do, but most people just need a little guidance. And so my programs are a week-to-week, step-by-step, instructional videos, one-on-one appointments with me. You can always ask for feedback or help or anything that you need. And these programs truly are transformational because it lets you know exactly what you need to do in order to be successful. And people who commit themselves to my programs have amazing results, and it's such a pleasure for me to work with people and help them become their most healthy and vibrant versions of themselves. My first 20 to 30 minute consultation is free, and that just allows me to get a better understanding of what is happening with your body and whether or not we would be a good fit for one another. So you have nothing to lose by reaching out. I always love to meet new people and hear their story, and hopefully I hear from you soon.